Wound, though the construction and the performance of the weapon is of vital interest to the forensic firearm examiner, the relevance of the pathologist is to concentrate in those aspects which affect the nature of the wound. So, we are mainly concerned with the bore of the weapon, muzzle velocity, nature of the projectile, propellant used, degree of choke. Choke means if a smooth bore weapon is there, then sometime it is being little choked here. Means there is a some types of narrowing, it is called choking. The amount of choking is generally done to reduce the dispersal, because when we fire a firearm or shotgun, the moment it comes out from the barrel, then it disperses. The choking is done to reduce the dispersal. Range of discharge and the angle of discharge. We are much more concerned with the angle of discharge, because it can affect the wound which is being caused. Wound inflicted by a smooth bore shotgun. We can the different things can constitute the cartridge. That is the lead pellet, which is very important. Soot from the smoke, unburned propellant, then the flame, hot gases, carbon monoxide which is coming out from the muzzle, wax. These all can demonstrate different types of injuries. Lead pellets can lead to different laceration or the stab wounds, different types of wounds. Smoke can cause blackening. Unburned particle can cause soothing or tattooing. Flames can cause burning. Carbon monoxide can cause redness of the entry wound. Different we will be seeing in the coming lecture. Wound from the shotgun, flame can reach up to 30 centimeter, smoke can reach up to 45 centimeter, unburned gunpowder can reach up to 90 centimeter, cards and wets can travel up to 2 meters, wets which are also present into the cartridge can travel up to 5 meters. These are the component of the cartridge which moves when there is a discharge of the or burning of the gunpowder from the gun. Then we can say how the injury is caused, and it all depends upon the distance between the object and the gun. If it is very close contact, then the chances that maximum things are pushed into the body, and you can find a split wound. A split wound is generally because of the gases which enter the tissue and they expand, and they cause immediate ballooning of the tissue there, and that can cause splitting. A split wound from the contact over the bone, burning, soothing, tattooing, carbon monoxide, bruise, wets within the wound. These are the things that can be present in the contact wounds. Very commonly, you can find a thing. If it is a contact wound, we will describe each one as separately, but we are seeing it here. Contact wound, it can be of split wounds. Few centimeter, then we have circular wounds, round contact wound. Most of the time all the things again inside the body. At 1 inch, irregular holes, but it is still circular. Burning, soothing, tattooing, carbon monoxide within the wound. Then we at 2 centimeter we have rat hole like appearance. Wets can travel up to that. Irregular wound, satellite pellets. These are satellite pellets. Means the discharge is widening with distance. The projectile and the dimension is Widening, it means it is start from the gun. If it is gun, then it is starts widening. Depending upon the position of the victim, it will present the injury. So at about 2 to 4 meter, it is satellite wounds. You can find a single central hole and a satellite wound. At 4 to 6 meter, you can see that there is no center hole, but all the satellite wounds and central hole has disappeared, and the other things that can all the satellite wounds are separate and can penetrate. Whereas greater than 6 meters, no central hole or uniform pellet holes are seen. Uniform pellet holes are seen at more than 6 meters. So all the distances we can see that the more the distance is there, more is the expansion of the path of the pellets. Then we are describing separately hard contact within means if a barrel is pushed against the body and then fired, we can get very clear cut wound, and we can get very various that cruciate laceration. You can find laceration, but no, laceration is not here. Cruciate laceration is here, but the muscle imprint is there. You can see busting, fracture of the bone. If the bone is underlying, there may be fracture. Swelling or burning can be there. Track of the wound is charred or sheared. Blackening is there. Blast effect may be seen, and the other back spatters can be seen. Then we have loose contact or near contact wound, means slightly in the contact or near contact. Then we have various discharges here, which you can see. There is a discharge of the smoke or the gunpowder. Blast effect lesser than hard. This range much more destruction than rifle. Dimension equal to bore. Ragged margins. Crushed margins. Color is almost sometimes pink here because of the carbon monoxide. And muzzle impression is there. Sometimes muzzle impression, it is not here, but muzzle impression can be present. Wad can also be present into it. Close range up to 1 meter. Blast effect is less. Within 30 centimeters, singeing. Here you can see the singeing. Singeing is there, and blackening, tattooing, hair burnt, all is there. At a distance of 60 to 90 centimeter, only tattooing is there. Tattooing is also there. Tattooing is there. Then there is a rat hole. Sometimes you can find a rat hole, means central hole with irregular margins, you can see, not a circular margin. Short range 1 to 2 meter, size 4 to 5 centimeter, irregular, no burning, blackening, singeing or tattooing. Wad may present inside the. It is a short range where you can see short range here is here, but burning and tattooing are absent. Then intermediate range, you can find a pellet wounds. Pellet wound, that is called satellite wound. Short mass margin spread to 2 meters. Individual plate holes detected. Wad just strike the body. Then again we have distance range greater than 4 meter. All shot penetrates separately into the area of 10 to 15 centimeter. That beyond 30 centimeter is rare. By shotgun we have generally that ratio is just within short range. Long range, for long range we use rifle weapons or the pistols or the automatic pistol or the revolver. But for this short range, we use generally shotguns, which are very lethal in the close range. Here you can see the multiple plate injuries or multiple um, each pellet is showing its own injury. All shot penetrate separately in the area of 10 to 15 centimeter. That beyond 30 centimeter is very rare. Direction of the shotgun injury is also very important. It means how the shotgun has struck to the body and at what angle it has struck, and through which we can try to determine the direction of the pellets coming. If it is very important that if we can determine the direction, we can determine the how to which type of weapon or which height of a person or which direction is being used to cause the injury. So it is very important, and direction also determines the amount of injury that is caused. A shotgun blast trace out a shallow comes from muzzle. Shallow comes from muzzle, and simple geometry demands where there is a cone intersect in a plane of the skin. I said that the cone is there. Means that when the shotgun pellets are coming, they are expanding in the form of cone. In the form of they are expanding like this. That is a shape of a cone. Plane and circle will result only when the cone is at 90 degree. Means if it is it is acting as 90 degree, then it will act as a circular hole. In all other position, an ellipse will be, or as a ellipse or something like that. It is elongation, increasing the angle between themselves and decrease that. The pattern applies not only to the plate spread but to soot particle also, and the deposition of the and these all soot particle and the tattooing all will change with the angle. Depending upon the angle, it may spread like this, it may spread like this, it may spread like this. So you can determine the amount of discharge and amount of the directions and the direction, and from the direction you can determine the injury and the effect of the injury. The wound edges may be shelved. If it is shelved, then definitely it is not 90 degree being undercut, just like in the shelving of the smooth weapon like incised wound. Distal to the origin of the discharge, the appearance are similar to those seen in some knife wounds, where a oblique stab leaves tissue visible and one edge undercut the other. I will show in the coming slides. The track of the wound in the deeper tissue can be established, and this line projected backward to indicate the discharge direction related to the body. Here we can see there is an angled discharge. There is an angled discharge undercut in the skin and the shelved wound. Here we can see there is a different angle here. Is here. A shotgun, large defect in the chest wall because of the shot struck at an acute angle. Smoke smudged in the is extensive, showing an asymmetrical soot pattern, which I have already discussed. There is a asymmetrical soot pattern is there. There is a blackening and tattooing in this direction, not circular. So there is an angle in the wound. We should go for the X-rays. If it is the bullet or the pellet is inside, you can definitely see the different pellets here. Different pellets lodged in the ankle. Exit wound, generally if it is within the small range or within the child or within the some head, neck or limbs, then the chances are there are exit wounds. But most of the time, exit wounds of the shotguns are not present. If it is in the head, neck or limb and the children, small thin adults, the 12 bore commonly causes an exit wound which may extremely large and rugged with gross tissue destruction and exposed. We have seen cases in which the if a person has been struck from here and the whole part of the other opposite side of the skull and is blown away. That can happen, but not in the abdomen and not in the not in the chest, not in the abdomen. Generally, in the skull and the other limbs also you can find there entry and exit wound there. But most of the time the skull and the lower other and distant areas are may have the exit wound. One of the most common is that seen when a 12 bore is discharged suicidally into the mouth, which may disturb the head and expel most of the brain through the massive skull and skull defect, so called burst head. That I have already said, the burst head. It explodes if somebody puts your barrel here and fires, then the shotgun particles come out and explodes from the upper part, or some is struck from here and then the other from the other side it explodes. Then we can relate to that. Medical legal importance, nature of the death is important. It is suicidal or homicidal or accidental. Sometime nowadays in India we have very common is celebratory celebratory wedding gunshots, and it sometimes the bride is stuck and sometimes the groom is stuck, some of the other relatives are stuck. It may be accidental and it sometimes it may be homicidal also. So we are more concerned with the direction of the firing, distance of the firing and identification of the firearm used. So we can see that we have to move accordingly and examine everything, and we should know the how a shotgun varies, how a shotgun fires and how a shotgun propellant is used, how a shotgun pellets are being expelled from the shotgun, and how it can cause the injuries to the tissue, and what we can find at the examination of the gunshot. And if we can see that there is a pellet inside the gunshot wound, if we can see there is a wad inside the, if we can see the clothes sucked inside the wound or the other particles impurities are there, so we can relate into that depending upon the different circumstances that we can get different types of injuries of a shotgun, and we will be able to elaborate the things if with the experience coming and recurrent examination. We can see that these injuries are very common in India, and we will be having very much useful things to examine, and we will be having a video in this slide also, in this lecture also we will be attached later on, and you can see the how the shotgun works, how the shotgun propellants works, how the bullets are discharged, and it is a video will be attached, and we will see that we will be having a very good memory on that, how the shotgun works and how the tissues affected and can be examined in the coming video, and the coming lectures we will be able to deal with the rifle weapon and the other blast injuries. Thank you very much.